We are back once again here on Healthy Living, and we're talking about cardiothoracic surgery with a phenomenal team that we have here at Hilton Head Hospital. And thank you for joining us again today. What I'd like to ask, and during the break we sort of chatted about this a little bit, was demographics. I was asking, you know, are we talking about 92-year-old men? What about a 69-year-old woman? What about younger folks and cardiac issues? I would think you run the spectrum?
Yes. The important way to think about it are the risk factors for cardiac surgery.
Okay.
The 5 big risks: smoking, if it runs in your family, high blood pressure, high cholesterol, and diabetes.
Okay, let me repeat that. See if I actually listen. Smoking, genetics, diabetes, high blood pressure, and what am I forgetting?
High cholesterol.
High cholesterol, that makes sense.
Yes.
So those would all be benchmarks or things that I should pay attention to if I have those.
That's right. And another thing, the genetics part of it is critical too when you look at the spectrum of ages that we treat. We call in, say, a younger person that has blockages that require surgery, we call it premature coronary artery occlusive disease.
Okay.
If one of your family members has premature coronary artery occlusive disease, then when you, even though you're at a younger age, 40s, 50s, early 60s, if you have that genetic predisposition, you should take the symptoms seriously.
Dr. Perry, one of my questions is just again going back to basics so that we can better understand is what is a bypass? What is a coronary bypass? What am I doing? And you said blockage. What is a blockage? May I ask just basic
Right.
questions?
So a blockage is a blockage in the coronary arteries, which are the arteries that supply the heart with blood. And a blockage can be anywhere between 50 to 100% blocked, depending on how severe it is.
And that blockage consists of?
Cholesterol,
Okay. Oh, okay.
calcium. And typically patients will start to have symptoms such as shortness of breath, chest pain, or shortness of breath with exertion.
And as a woman, am I going to present with symptoms a bit differently?
Everybody presents a little bit differently. Some
Okay.
people will have some pain that radiates down their arm. Some people feel some pain in their jaw.
So the takeaway is if you feel anything, heaviness, anything out of the ordinary, do not hesitate to go to the doctor because...
Yeah, one critical thing is that the heart being the pump that supplies the entire body.
Okay.
I think you can have symptoms from head to toe that could be indicative of blockages. It could be your heart, your stomach, nausea, vomiting, swelling in the legs, dizziness, sleeplessness, even fatigue. So many of our patients present and they said, you know, I've not been able to do as much as I usually do. I just attributed it to old age. And what it could be, early fatigue could indicate a problem with the heart. But every organ system can be affected.
And so then the bypass that you're performing is actually what? What is happening?
I like to describe it as a detour. So I was previously in Colombia and there was an area called Malfunction Junction. And so I would describe to my patients, they're in the I-20, 26 area.
Oh, I know exactly where that is.
If it was blocked off there because of an accident or whatever, bypass, we're not going and fixing and taking away that blockage, that accident. We're going to go around it. So we may go through downtown Columbia to then get you off on I-20 in another area. And so we go bypass around it. And so that's where bypass surgery is.
What kind of a surgery is it? How long is it? What's the recovery time? Obviously, it saves lives and adds a lot of years to people's lives.
Surgery can last anywhere between 2 to 5, 6 hours, depending on how many bypasses we're doing.
Oh.
Yes, ma'am.
So the more that we do, the longer it's going to take. But typical recovery is usually about 4 to 7 days, I like to tell patients.
Wow.
Absolutely, yeah.
I mean, that surprises me. I think we think of that as it would be a much longer recovery.
Right,
And then
right.
how long in the hospital? 3 or 4 days?
Total hospitalization is about 4 to 5, 6, 7 days. An acute phase where you're in the ICU for a couple of days, then out to a floor for another 3 to 4 or 5 days. And really, when you get discharged is very dependent on that patient, both for the medical reasons, but also if they are advancing with their activity, and that's the biggest indicator. We want them up and walking. For
That's what I
reasons.
want to do we're going to take a quick break and we're going to come back and we're going to talk about post-surgery, what to expect, because I'm actually feeling a little anxious at this moment, wondering if I had had that surgery, how I would feel after. Stay with us, more to come on Healthy Living.